Nur Fasihah binti Aman, Nur Fadilah Hamir, and Sanjita anak perempuan Perianan. A breast biopsy is performed to take a sample of breast from a suspicious area to be examine them under a microscope to determine a diagnosis. This procedure that involves a hollow needle and image guidance, but in some lump that can be palpable, doctor will never use the MRI guidance or ultrasound guidance or mammogram guidance. The doctor will usually order a biopsy if they are concerned about the results of a mammogram or breast ultrasound, or if a lump was found during a physical examination. The biopsy also done if there is unusual nipple or areola changes, including crusting, scaling, dimpling skin, or a bloody discharge. Breast biopsy procedure can be guided using MRI, mammogram, or ultrasound. Open surgical biopsy involves the surgical removal of a breast mass. Afterwards, the sample is sent to the lab. Then the breast mass being examined, the age to ensure the entire lump was removed if it is cancerous. A metal marker may be left inside the breast to mark the area for further investigation if needed. There are a type of breast biopsy: fine needle aspiration (FNA), core needle biopsy (CNB), stereotactic breast biopsy that usually done on the mammogram guidance, excision biopsy, vacuum assist core needle breast biopsy that help to take a sample during the breast biopsy. Fine needle aspiration (FNA) biopsy. The doctor uses a very thin hollow needle attached to a syringe to withdraw, which is aspirate, a small amount of tissue or fluid from a suspicious area. The biopsy sample is then checked to see if there are cancer cells in it. If the area to be biopsied can be felt, the needle can be guided into it while the doctor is filling it. If the lump can't be filled easily, doctor will use ultrasound to guide the needle during the procedure. This is the example of the aspiration using the ultrasound guidance. Okay, this is the example of NA biopsy using the ultrasound guided. For the palpable lesion, the FNA can be carried out under clinical manual guidance without using the ultrasound imaging. For patients who are taking the blood thinner, FNA can be safely used to obtain cells to help diagnose a lesion without them having to stop taking the medication, as may be necessary with other more invasive procedures such as a core biopsy. So after the procedure of mammogram or ultrasound breast, the patient can straight away do this procedure after doctor can detect any suspicious lesion on the breast. For this procedure, local anesthesia is recommended to reduce the pain at the affected area. During the procedure, the doctor will insert the needle into the lesion and the needle will move forward and backward several times to collect a cell. 2 or 3 separate samples are usually taken in this way to ensure a good sample has been obtained. If the lesion is a simple cyst, the doctor will aspirate the fluid from the cyst until it collapses. And then the sample will sent to the lab to do some examination to detect if the sample is cancerous or not.
Core needle biopsy. The short form is CNB. CNB often be the preferred type of biopsy if the breast cancer is suspected because it removes more breast tissue. Hollow needle to take out a piece of the breast tissue from the suspicious area the doctor has felt or has pinpointed on an image test. The needle may be attached to a spring-loaded tool that moves the needle in and out of the tissue quickly, or it may be attached to a suction device that helps pull breast tissue into the needle. A small cylinder of tissue is taken out in the needle. Several cores are often removed. The doctors doing the CNB may put the needle in place by filling the lump, but usually the needle is put into the abnormal area using some type of imaging test to guide the needle into the right place. Some of the imaging tests a doctor may be used include ultrasound, MRI, mammogram. Typically, a tiny tissue mark, also called a clip, is put into the area where the biopsy is done. The marker shows up on the mammograms or other imaging tests so the exact area can be located for the future treatment if needed or follow up. Stereoetic breast biopsy. To help locate a breast abnormality and remove a tissue sample, breast biopsy uses mammography, excellent way to evaluate calcium deposits or tiny masses that are not visible on ultrasound. It may be performed when a mammogram shows a breast abnormality such as suspicious mass, microcalcification, which are tiny cluster of small calcium deposits, a distortion in the structure of the breast tissue, an area of abnormalities tissue change, a new mass or area of calcium deposits in a previous surgery site. Tissue samples is obtained using a vacuum assisted device, a vacuum powered instrument that uses pressure to pull the tissue into the needle. This instrument rotates position and collects the multiple tissue samples through one needle insertion. Okay, this is the sample of image where the stereoetic breast biopsy, where the tissue sample will be taken, and this is the image where they show this ultrasound image of breast and mammogram image of the breast. Okay, this is excision biopsy. An excision biopsy is the removal of a lump or sample of the suspicious tissue by surgery for examination under a microscope to give a defined diagnosis. For lesions that are small, accurate marking of the area for surgery is necessary. This includes using the ultrasound during the surgery or with the procedures done just before the surgery to mark the area to be operated. Ultrasound mammogram or MRI can be used to insert a small tiny wire to the abnormal spot in the breast. The wire is used to guide the surgeon to remove the area accurately. This technique is known as hook wire localization biopsy. This is the example of the accession biopsy, and where the wire is used to guide the surgeon to remove the area accurately. And this technique also is known as the hook wire biopsy. And this view was done in MLO position.
My name is Nur Fadila binti Hamir. We continue with a vacuum-assisted core needle breast biopsy, as we call as VAB device. Use a larger bore needle vacuum with a vacuum component to obtain tissue sample from a non-palpable lesions. Non-palpable lesion is really hard to find, so we use this device to assess or to get the tissue sample from the non-palpable lesions. More tissue is usually obtained using the VAB device than the usual core needle biopsy, and the number of strip removed is dependent on the area that the physician or the radiologist that need to be examined. As we can see from the image, the ultrasound guided for lesion visible with ultrasound is performed under local anesthesia by radiologist and surgeon. Okay, next we go to the patient preparations. Patient need to remove some of the clothes and wear the gown during the exam. Patient also asked to remove jewelry, removable dental appliances, eyeglasses, and any metal object or clothing that might interfere with the X-ray image. Important to inform the doctor if there is any possibility the patient is pregnant, especially for the procedure using the radiations. Patient cannot wear deodorant, powder or lotions, or perfume under the arms or on the breast on the day of the procedure. It is the same instruction as we given to the patient to do the mammogram, as we need to avoid misdiagnostic that may appear in the images. Inform the doctor if patient take any blood thinner medications or herbal supplements to decrease the risk of bleeding. Also ask allergies if any, because patient will be given anesthesia. This is really important because in the breast biopsy procedure, have a needle to punch it to the breast, so it may increase the risk of the bleeding to the patient, and also the allergies to the patient if we are using the local anesthesia during the procedure. Next, in the patient preparation also, make sure patient very comfortable while positioning to avoid patient movement during the procedure. Doctor will clean the biopsy area with antiseptic to avoid any infection during the procedure. All the items that used during the procedure must be sterile. Patient will be given local anesthesia or called as LE before doctor punches the breast sample. After the procedure done, apply the pressure at the affected area to stop the bleeding and reduce the swollen at the breast. Next, we go to the advantages of breast biopsy. The breast biopsy is less invasive except for surgical biopsy. Leaf litter or no scarring can be performed in less than an hour. Stereotactic breast biopsy is an excellent way to evaluate calcium deposit or masses that are not visible on ultrasound. The breast biopsy is a simple procedure that may be performed as outpatient. That means patient can just walk in to come to the procedure, and then after done with the procedure can go in back to the home lah. Compared with open surgical biopsy, the procedure is about one-third the cost, so it can help the patient to reduce the cost. Very little recovery time is required because just a needle punctured to the breast tissue sample to take the sample, and it will be fast recovery time. Generally, the procedure is not very painful. Recovery time is brief and patient can soon resume their usual activities. Next, no radiation remains in patient body after an X-ray examination for stereotactic breast biopsy. Next, we go to disadvantages. If some procedure have advantages, then they also have disadvantages. There is a risk of bleeding and forming a hematoma or a collection of blood at the biopsy site. It also can cause a bruising or swelling of the breast and altered appearance of your breast depending on the size of the tissue being removed. And then an occasional patient has significant discomfort, but patient can take any painkiller pills after the procedure is done. Any procedure where the skin is penetrated carries a risk of infections. The chance of infections requiring antibiotic treatments. Uh, Next, depending on the type of biopsy being performed or the design of the biopsy machines, a biopsy of tissue located deep within the breast carries a slight risk that the needle will pass through the chest wall, allowing air around the lung that could cause the lungs to collapse. Then, there is a small chances that this procedure will not provide the final answer to explain the imaging abnormality. True-false result uh, will be arise. Next is women should always inform their physicians or X-ray technologists if there is any possibility that they are pregnant. see the safety in